Hello, my name is Dr. Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. Today is Tuesday the 16th of June and this is my update. At the moment we are showing 36 COVID positive patients on our acute wards. What I mean by that is patients who are thought to be actively COVID positive and are being treated for that condition. I've mentioned to you before that we have more patients in hospital who have ever been COVID positive. They may well have been home and come back in, but at the moment our data shows that we have 36 patients who are actively positive, and when I made this tape last week we had 52, so that's a pleasing reduction. It's also pleasing to say that we've made no new diagnoses in the last 48 hours, so we appear to have entered into a new phase, but we remain very cautious about that as lockdown has eased, as we've seen much more movement of the general population. We need to remain very careful. We're also part of the track and trace programme, so if any patients or citizens in the community or staff are being tested positive, we get information about that, so we do track and test within our own staff, and our occupational health service work that through. That has led to 2 small teams being asked to self-isolate for a period of time, and that's really important in terms of our ongoing control of the COVID situation. We've shown on our data 216 deaths, and that is an increase again from the figure I gave last week. Some of these are technical adjustments as medical certificates are reviewed. There is no doubt that our death rate has fallen, but it is not zero, and I will report that to you when that occurs. We've also got 3 patients in COVID ITU at the moment, and that situation appears to be stable also. The antibody testing has carried on at about 300 tests per day. We're doing those tests both for our own staff and also for staff from neighbouring trusts. Of our own staff, we've done over 4,000 tests, and the positivity rate is showing at 18%, and we believe that is equivalent to the results being shown around the northwest of England. One big development this week has been the introduction of masks for everybody entering the hospital, both clinical staff and patients. So all staff coming in through any of the entrances to the building are required to put on a surgical face mask and wear that mask in all public areas. When they are then in clinical duties, if that's what they are doing, they will be changing into their clinical masks, but the administrative workforce are wearing those masks throughout the building in public areas. Now, for members of the public coming to the hospital, it is preferable, please, if they can bring their own face covering to provide that protection in public areas. We do have masks available and we will make them available to visitors, but obviously we're anxious about our stock levels and we need to be able to maintain this cover throughout the period. So if it is possible to come with your own personal mask, that would be much appreciated. Finally, I want to thank everyone again for ongoing vigilance. Although our numbers are much improved, it's clear that this pandemic is not over and we need to stay very alert. We need to be cautious in our behaviour and to self-isolate and get tested if we feel we are showing any symptoms or signs of COVID. Thank you.